professionals and their patients. Today, we are honored to have Dr. Sampat Jain, a renowned consultant physician from Kolkata, as a guest speaker. With over 20 years of experience in the field, Sir is known to provide exceptional care to his patients. We are grateful for his dedication to improving liver health and educating patients about this important topic. So, without further delay, I would like to invite Dr. Sampath to share his valuable insights. Over to you, sir.
Thank you. And good evening, everybody who are watching this program today. As you just heard, that is a very important topic which we are going to discuss today, the management of MASLD or MASH. In short, what is MASLD? That is a metabolic dysfunction associated steatotic liver disease or metabolic dysfunction associated steatohepatitis. Earlier, we used to call it NAFLD, that is a non-alcoholic fatty liver disease. But because of the stigmata of alcohol, now the nomenclature has been changed to MASLD and MASH. As you all know that the liver is the second largest organ of our human body, weighing almost 1.5 kg with 5% of fat. It is located in the right upper portion of the abdominal cavity, soft in consistency and highly vascular organ. As you all know the functions of liver, it controls almost 500 metabolic processes. It regulates the production of protein and cholesterol. It processes nutrients, produces bile, which is stored in the gallbladder and released in the intestine for the food digestion and absorption, detoxes the blood, restores the old RBCs, it regulates the blood composition, and it also helps in the breakdown of alcohol and medications. So most of the drugs are metabolized in the liver. Now, understanding the MASLD, as I told you, that metabolic dysfunction associated fatty liver disease, as the name suggests, it is a metabolic disorder. It is a condition in which the fat makes more than 5% of the weight of the liver, not caused by alcohol use. If left untreated, it can progress into the MASH, that is a metabolic dysfunction associated steatohepatitis. Being overweight or obese, having type 2 diabetes or high cholesterol, they are associated with increased risk of MASLD. What is the prevalence? 1 out of 4 people have this type of liver disease regardless of their weight, and more than 6 diabetics and 9 severe obese people out of 10 have MASLD. The male gender has been regarded as a risk factor for progression to the MASH and fibrosis. So what is the progression of the liver disease? That healthy liver leading to the fatty liver if the fat composition is more than 5%, which may lead to the liver fibrosis, that is a scar tissue formation, more cell injury, and finally leads to cirrhosis of liver. As you all know, this is the terminal, you can say, stage of the fibrosis, that is a cirrhosis, shrinkage of liver. The scar tissue destroys the liver tissue and liver is unable to work properly. So what is the difference between the MASL and MASH? MASL is only the steatosis, that is a fat accumulation in the liver, which we normally get in the sonography reports in our day-to-day practice. And MASH is the fat accumulation plus inflammation and scarring. So the thing is very much clear. Only fat in the liver is a fatty liver, is steatosis. And if there is inflammation and scarring along with that, then it is not termed as the MASH, which is more fatty. And this may progress to the cirrhosis. So fat accumulation is also known as the steatosis or fatty liver. This may lead to inflammation of the hepatic cells and known as the metabolic dysfunction associated steatohepatitis. Scarring of the liver on benign stage is also known as fibrosis. What are the causes of this MASLD? The most important cause is our food habits, eating junk foods, fried foods, physical inactivity, metabolic syndromes, obesity, genetic background, and being exposed to certain medications. These are the common causes of MASLD. The obesity and the fatty liver disease. Being overweight or obese causes fat to accumulate in the liver due to the eating pattern, sedentary lifestyle. So obesity increases the amount of fat to constitute more than 5 to 10%. And this leads to MASH and scarring of the liver. So association between MASLD and diabetes is bidirectional. On one hand, that is a diabetes, another hand, MASLD. Threefold increased risk of death due to cirrhosis, increased risk of MASH in case of diabetes, and if you have a MASLD, there is a high prevalence of diabetes, 2 to 4-fold increase of developing diabetes in cases of MASLD. What are the symptoms? Many times non-specific symptoms, may have extreme fatigue, loss of appetite, nausea, jaundice, and abdominal pain, weight loss, enlarged blood vessels seen in the over the skin, enlarged spleen, either palpable or seen in the sonography, red palms, or in extreme states, confusion and trouble concentrating. How to diagnose this MASLD? The fatty liver can be a silent killer because the progression of the disease is very gradual. The diagnosis is often involves the following things. The first and foremost is the blood test, which we usually prescribe to our patients. That is the liver function test. Second is the ultrasound or fibroscan. Third is the liver biopsy or pathology, and X-ray, CT, or MRI. Most common blood tests are SGPT, SGOT, which we are doing routinely in our patients. That is ALT and AST. Persistently elevated ALT, that is SGPT, can be associated with disease progression. Patient with normal SGPT levels can also develop progressive disease, and up to 80% of the MASLD patient can have the normal SGPT. So we should be clear about this, that normal report doesn't rule out MASLD. No designated ALT cutoff for prediction of MASH or advanced fibrosis in MASLD patients. Using these blood tests and various scoring methods, we can establish like FIB-4 or NFS NFLD fibrosis score, which are commonly used, and they are easily available on online. And you can calculate these scores by putting the values. In FIB-4, we need 4 values, that is the age of the patient, AST, ALT, and platelet count. These scoring methods have been established to diagnose more better than the ALT or AST alone. In NFS NFLD fibrosis score, 3 more criteria, the values are included. That is the BMI, fasting blood sugar, and albumin. Non-invasive diagnosis of MASLD, the most common is the ultrasound, easily available, economic, and reason for most accidental diagnosis of MASLD. So in the ultrasound report, very commonly we see the patient has grade 1, grade 2, grade 3 fatty liver. So the drawback of this ultrasound is only detects the MASLD if the fat is more than 25%. It cannot differentiate between the fat and fibrosis. So for that, we need some other test like transient elastography or fibroscan. In fibroscan, MASLD can be diagnosed with the fat content more than 10%, differentiate between the fibrosis and fat, and it is also very easy to operate. And it can be done in the chambers also. But drawback is the misinterpretation in obese patients or patients with ascites, that is a fluid in the peritoneum. Liver scan, it also works on the principle of transient elastography. We get 2 different values from this liver scan, that is the LSM score and CAP. LSM is the liver stiffness measure. It indicates the degree of fibrosis in the liver, and the CAP is the controlled attenuation parameter that is it indicates the degree of steatosis in the liver. Then we come to the MRI, which is a gold standard to detect the fat content. It can measure the fat content even more than 1%. Widely used technique for the liver donor patients, but only drawback is very costly and not widely available in all the centers. And finally, the gold standard is the liver biopsy for diagnosing the MASLD or MASH. This is the only method to diagnose the MASH, that is steatohepatitis. It rules out the other liver diseases as well, like liver cancer, hepatocellular carcinoma, or other pathologies. Drawbacks are the painful, individual dependent, and chances of misdiagnosis in early stage of MASLD. The progression takes years. As I said, that is a very slowly progressive disease. It is a silent killer. So early intervention will always be beneficial. If you have a fatty liver today, 70 to 75% chances are that it will remain fatty liver forever, or it will have fatty liver with mild inflammation. But in 20 to 25% patients, it will go to the next stage, that is a MASH, steatohepatitis, inflammation. 11% of them over 15 years, they can develop cirrhosis. And out of that, 7.2% over 6.5 years may develop hepatocellular carcinoma, or 20 to 45% over 7 to 10 years can go for the decompensation of liver disease, decompensated liver disease. So there is an increased risk of death compared with the general population with MASH, either cardiovascular or malignancy or liver related. MASH with fibrosis portends the worst prognosis. Fibrosis progression is associated with diabetes, severe insulin resistance, weight gain more than 5 kgs, and rising SGPT, SGOT. So we should act before it is too late. Progression of MASH can also increase the risk of the heart-related diseases. It is a more serious form of MASLD in which you have scarring of the liver. It can lead to cirrhosis or liver cancer. And severe MASH is not reversible. That should be clear in our mind. So the treatment part, speak to your doctors about the treatment options. As I said, it is a metabolic dysfunction associated disease. So we must emphasize on the lifestyle modification, the diet and exercise. These are the three main pillars. And after that comes the medications. So first and foremost is the lifestyle, diet and exercise. Because it has been seen that only weight control can give you much great benefits than the medicines. The combination of the hypocaloric diet and moderate intensity exercise provides the best likelihood of sustained weight loss. Weight loss of at least 3 to 5% of the body weight helps to improve the steatosis, and loss of 7 to 10% improves majority of the histopathological features of MASH, including the fibrosis. There are very few drugs which can act on the fibrosis, but weight control can help to regress the fibrosis. So here is the chart that weight loss effect on MASLD. If you have a weight loss of more than 3%, steatosis is decreased by 35 to 100%. Weight loss of more than 5% has beneficial effect on the inflammation and ballooning, 41 to 100%. Weight loss of more than 7%, NASH resolution, 65 to 90%. And weight loss of more than 10%, it can reduce the fibrosis to an extent of 45%. So there's a great advantage of losing weight. So diet for the healthy liver is the Mediterranean diet. Everyday diet should be the The lower part of the pyramid, it is a meal containing more vegetables, fruits, whole grains, olive oil, beans, nut, legumes, seeds, herbs, and spices. Often, that is a twice each weekly, you can use the fish and seafood. Weekly, moderate portion of the eggs, cheese, and yogurt, and less often red meat and sweets. We always tell our patient to avoid red meat and sweets as much as possible. Then types of exercise which will help in the fatty liver is aerobic exercise and resistant exercise. What are the advantages of aerobic exercise? It reduces the liver fat, maintains the healthy weight, improves the cardiovascular condition. Resistant exercise reduces the liver inflammation, improves the glucose absorption and insulin sensitivity, and improves the metabolic parameters with less energy consumption. Thereby, the fatty liver can become a normal liver. So, lifestyle tips to tackle the MSLD and MASH is very clear. Lower your sugar intake to reduce your weight. Eat small, frequent meals, regular medical checkups, get enough vitamins and minerals. So, you should include in the diet vegetables and fruits, that is, the more fibers, get enough sleep, and develop an exercise routine and stick to it. So lifestyle modification is very difficult to maintain, but if you stick to it, you will get the definite benefits. Now, finally, we come to the pharmacological approach. We have certain drugs in our hand to deal with this MASH or MSLD. One is the pioglitazone, pipergamma agonist, which is used in the diabetic patients. So NASH with or without fibrosis in both diabetic and non-diabetic patients, you can use the pioglitazone, minimum duration of 2 years, and definitely helps in regression of the NASH with or without fibrosis. Second molecule is the seroglitazar. It is an Indian molecule. NASH with or without fibrosis in both diabetic and non-diabetic patient. It can also be used 1 year. You can get definite reduction in the LMS score, this one, liver fibrosis or liver stiffness measure, LSM score, is reduced with the use of seraglitazole. And finally, the vitamin E, which should be used in only non-diabetic patients and pediatric patients, NASH with or without fibrosis. And duration, minimum duration is 2 years. So, tips to prevent the fatty liver disease: limit the intake of saturated fat and trans fat in your diet, eat a balanced diet, limit consumption of refined carbohydrate, quit smoking, exercise regularly, limit or avoid alcohol, maintain a healthy weight, and take medications as prescribed by the doctor. So these are the few tips. So let's not be silent anymore about this silent disease. As it is growing at an alarming rate in India, let's bring it under control. Your liver could still be at risk even though you don't drink alcohol. So this is a misnomer. It is not an alcoholic liver disease. This is a metabolic dysfunction associated liver disease, which may be fatal in long run. Thank you. Thank you very much for your patience hearing. If you have any comments or questions, you can share in the chat box.
Thank you so much, sir. Sir, now with your permission, we will like to hear your thoughts on few questions.
Mhm.
So can we start, sir?
Yeah, sure.
Sir, can MASLD and MASH be age specific?
Age specifics of, yeah, especially we get the mass or mass in the young adults or in even the age when the age is progressing, you are getting the more and more number of patients. Not in early childhood, but now the obesity in the early childhood is also increasing. So it may cause lead to the MSLD. not MASH, but MSLD is commonly seen in the early childhood as well. So we should not ignore this. So the lifestyle modification should start from the very beginning, from the childhood.
Okay, sir. Sir, is fatty liver a reversible disease?
Yeah, fatty liver, as I said, if you can control your weight or you can reduce your weight to certain extent, that is more than 3% or more than 5%, definitely you can reduce the fat in the liver. So it is a reversible. If you ask me only about fatty liver, it is reversible. If you ask me about the MASH or fibrosis, to some extent it is reversible. As I told you, if you reduce the body weight by 10, more than 10%, then only 45% fibrosis is reversible, not fully. So we
Sir,
should,
what kind?
uh,
Yes, sir.
yeah, you should start the treatment very early. Then only we can
Okay.
stop. Yeah,
Sir, what kind of exercise will you recommend for fatty liver patient?
yeah. Fatty liver patient, as I said, that the two types of exercise. One is the aerobic exercise, another is the resistant exercise. Both are helpful in different forms. The simple aerobic exercise will reduce the fat in the liver, and this aerobic exercise will increase your insulin sensitivity and reduces the inflammation in the liver. So both together are helpful.
All right, sir. Now, on behalf of NASH 24 by 7, I extend my sincere thanks to Dr. Sampat Jain for his enlightening and engaging talk on MASLD. I also want to express my sincere thanks to our audience for their participation. Stay connected with NASH 24 by 7 on Facebook page for more updates and information. Take care, stay well. Thank you so much, sir, for joining us today.
Thank you. Thank you very much for listening patiently. Thank you.